So, Dr. Rohde, thanks for joining us today. Just wanted to catch up with you, see what's been happening in your practice for the last month or so, and kind of how the impact of this pandemic has been felt with you and your team there in Santa Barbara.
Yeah, well, yeah, it is interesting. We're going on. This is the end of week 4 that we've essentially shut down. Um, I don't, I don't know of anything that's really affected our industry like this. Probably ever since GV Black was walking the streets of Chicago. Um, I mean, pretty much what we've been mandated to do, along with everyone else in the country, is to basically no more cleanings, no more aesthetics. Or I mean, if there's any way to avoid the drill and just um, just patch up for the time being, then that's what we have to do. Interestingly enough, our whole teams at home. I mean, we furloughed 15 people. Um, Here we are. We're growing. Everything's great. We moved into a new location last June, and then, like everything else, we had to just shut it down. So it's kind of an interesting time because I think mostly for a lot of dentists, they just don't know what's coming. Like, well, when are we going back to work? And no one can really say. And I've heard 2 more weeks, and I've heard 9 months.
Mhm.
Um, so that's kind of where we're at. But we're still seeing emergencies. You know,
Mhm.
um, I do feel it's kind of our obligation as dentists to do everything we can to keep people out of the ER. I mean, and no judgment on anybody, but I've heard stories of offices just fully shutting down. We're not seeing anybody. Goodbye.
Mhm.
And then those patients have a toothache that we could have helped with, and now they're in the ER, and it's taxing in 2 ways. Now you put one of our dental patients that we could have helped in the ER where all the sick people are, so that exposes them more potentially. It takes up time and energy and resources for the ER doctors. So, not to over glorify our position as dentists or anything, but I do feel it's an important thing that we remain open,
Mhm.
albeit at a limited capacity for that stuff.
hmm And I've seen some statistics through the ADA who've been doing some surveys over the past few weeks, and I think that they had said it's about 20% of practices that closed completely. Just, we're not going to see emergencies. We're just going to shut down. You've kind of addressed that. What type of emergencies are you seeing come into your practice? And are they existing patients, or are you finding some new patients who are really in need are, coming out to get care?
Interestingly enough, because some of the practices have closed completely, we are getting those calls now. I mean, it's kind of a stepwise approach, right? The first is phone triage. Is there anything we could do? Can you send us a picture of what's going on? Um, a chipped front tooth. You're going to have to look funny for a few weeks. Sorry, we're not doing that.
Mhm.
Um, but I had a guy come in, upper left premolar, literally split right down the roots, right in between the two roots. And so we took a look. We said, look, you got to get this tooth out. Made the appropriate referral to the oral surgeon. We've had people come in and their faces swollen, and I mean, so it's interesting because people haven't stopped, even though it's supposed to be quote closed, people haven't stopped having dental. So what we opted in the meantime to keep us safe as we can is, number one, full screening. You
Mhm.
are asked, have you been sick of any kind of sick in the last 2 weeks? Any fever, anything. Number two, have you been around anybody, that has been, we're not even asking if they had the virus because we don't even know, there's not enough tests anyway.
Mhm.
Um, so what we're doing is just kind of question screening. Um, and then the second thing we're doing is taking a temperature
Yeah.
with a non-contact infrared thermometer. Um, and yesterday we had someone come in, he was 101, and we're like, sorry, we can't let you
Mhm.
back. I mean, he didn't make it past the front door. Um, Mostly because we just don't, and if we get it, then our whole team goes down. How effective am I, right?
Mhm.
Um, Now, once they're back, the other thing we're doing is we're only seeing one person at a time. We have 12 operatories in our office, and we're doing one person at a time, which is kind of spooky. different way. Um, but right now, we're just doing everything we can to avoid the drill because of the possible aerosols. I feel comfortable with our infection control
Mhm,
procedures. I mean, in that way, we already should have been wearing barrier protection, wiping surfaces down, sterilizing instruments. I mean, and
mhm,
to that point, we're only trying to see healthy people. Obviously, someone could be a carrier. And
mhm,
if we just everybody like they have it, that's kind of the core of universal precautions anyway. Um,
mhm,
you know, maintain a level of paranoia, but not so much so you can't try to help people, I guess, you know.
mhm. And you kind of touched on it a little bit, but with the personal protection, the cross contamination procedures that are cross contamination prevention procedures that you have in place, is there really anything new or different you're doing besides the one patient at a time and the pre-screening for temperatures? Or, you know, are you feeling that the dental industry was kind of already operating in this environment of trying to prevent viral and bacterial infections from moving around the population?
Yeah, I mean, it's funny when this first opened up, this whole concept that this thing was coming back in January, we did a thorough reevaluation of our practices. Are we doing everything that we should be doing? Kind of huddling as a team and going like, okay, how are we doing things, and are we being totally rigid on that? And so in some ways, no, nothing changed. The things that we're looking at that are different besides that screening are things like in-office HEPA or air filters. For example, there's a few
Mhm,
manufacturers out there that can recirculate the air in your office, so that if there is anything that's aerosolized, it'll pick it up and kill it.
mhm,
With a combination of filtration and also UV and things. Now, the question is, yes, should we have been doing that anyway?
mhm,
I mean, is this different from flu season where we're aerosolizing influenza? Well, looking back on it now, I think we could probably add a measure of protection there. Um,
mhm,
and then the other thing we're looking at too are these kind of whole room UV sanitizers where they basically blast the whole room, including the air. And those are known to kill viruses as well. So of course, then the correlation, does it kill COVID-19? And but those are some additional things we're looking at where you close the door, you roll this thing in, you turn it on, and it just blasts the room, and
mhm,
maybe that. So I don't know if that's where we'll end up, but we're certainly researching. Is there anything more we can be doing? What's out there? How can we change this? Can we add something to our existing HVAC that would also additionally kind of protect us and our team?
mhm. Do you expect that there will be some new, more stringent regulations, on the backside of this as practices start to reopen? That there will be kind of a new normal in terms of what operating procedures should be when it comes to infection control?
Well, it's interesting because we keep hearing all these stories of some people out there, they're just afraid now to come.
Mhm. Yeah.
Um, and I can say business as usual is, but there's also a level of fear right now.
Mhm.
Like the science part is one thing, but um, managing people's emotions and helping them understand what we're doing, or tackling this as a team, is a whole nother thing. So I think that's probably where um, I don't know if we're going to see necessarily new regulation. I mean, if OSHA came out with even newer stuff, all the better, right? I mean,
Mhm.
let's do everything we can. If they came out and said, "Oh, this type of nitrile glove is better than this type of nitrile glove," then
Yeah.
we would immediately switch. Um, but I think it's more of how we're treating things as a team, how we're coming to this, how we're creating confidence with our patients. Because just because they tell us we can turn the lights back on doesn't necessarily mean people are going to want to come.
Mhm.
Let's say May 1st. I mean, here we are, kind of partway through April. Let's say May 1st. They're like, okay, back to work, everybody. Good job. We did it. Numbers are down. I think
Mhm.
there's going to be a significant population out there that is like, nah, I'll give it another month or two. You know, not governed by the state, but by their own like protection. So I, it's hard to see what business as usual is going to be like, because I don't think it's really going to be there for a long time anyway. Not to be doom and gloom. I just mean this isn't just because they say turn the lights on, go back to normal, doesn't mean A, we're not going to be just as careful, or B, that we're going to have anyone to work on
Yeah,
anyway.
and I think you're hitting on a couple of themes I'm hearing when I'm talking with other clinicians as well, that, you know, patients aren't going to necessarily race back to the dentist. And I've heard, besides the, reasons you've brought up, the fear and the, there's been a lot of news that dental practices, aerosolization is a word that has come up in news broadcasts about why dental practices are shut down. People are going to have those concerns. Also, people aren't going to have time off from work that they might have had because they've been off work if they were able to keep their jobs through this and were furloughed or something. So, yeah, I think you're kind of right that there isn't necessarily going to be open the doors and you've got a line of patients. But what do you think you're going to need to be able to do to kind of break through some of those barriers and get people comfortable coming back to your chair?
Well, I mean, there's a couple of things there. One would be to make sure we're, let's say there's something to this air thing that we can, very well demonstrate we are cutting down circulated aerosols in the office. Then we should probably invest in that, right? I mean, if there's anything that we could do better, differently, and it might cost some, and we're all making zero money, so that's a hard concept to
Yeah.
swallow right now. Hey, let's buy all this new equipment. But I think it's something that we're going to potentially have to do if we want to ensure that we're keeping our patients safe and we're keeping us safe, our team safe. But the second part of that too is I think there's going to be probably a slow recovery. Again, not doom and gloom, but let's think about, so, let's say we have a patient who is a hairstylist, works at, say a restaurant, and they've been furloughed. I mean, there's a lot of people not working right now who also will have dental problems. So I think one of the things we can do besides make sure our environment is very safe for people is also to kind of work with them, figure out what insurance is going to cover, maybe triage stuff, maybe stage treatment out so that it becomes affordable, because all of a sudden someone who's not been working for 3 months and they need a crown, maybe there's some alternatives to that. Maybe they can afford, maybe we do some, maybe long-term temporary patchwork to get them through to when they can finally afford it, using things like care credit. I mean, I don't think, if you look back to like February, January, the way we were doing things, it's coming back. I know it, but I think initially we might have to be a little bit more flexible with how we treat and plan. Not that we want to do less than, but to work with people in a way that makes it so that these families can get their feet back on the ground and still keep their oral health where it needs to be.
Mm-hmm.
You know, we have, I think, always done that in one way, but it's like, okay, here's your problems, let's figure out what's going to be affordable to you, what's our priority, where do we start first. I mean, I've heard some people say, hey, wow, well, this would be a good time to drop any plans that you're in. And I'm like, this is the time where finally, it seems to be the holy grail for dental offices to go to cash only, no insurance. And I get why, then you don't have to deal with that, and you don't have to worry about negotiated fees and all that. But I think it's the one thing that's going to help our community is to continue to work with people and the insurance that they have, and make sure we make this affordable, because our whole world's taking a hit right now from this. So
Mm-hmm.
so that's the other piece that is, I think, going to have to change.
Yeah.
you know
In terms of what you're doing right now, how many patients are you seeing, in and out of the practice in a typical day when it's just emergencies? And, how big a hit is that to you? You mentioned you had 15 team members you had to furlough. So, where are you with your practice on the business side?
Yeah, so I mean, one of the things, we actually have a wonderful pediatric specialist that works with us. She basically, the way we have set up is we have one assistant, one office manager helping post stuff, post insurance checks, answer phones, move appointments, triage emergencies, and then we have one doctor. So, for example, we have one doctor on Monday, one doctor on Tuesday, one doctor on Wednesday. Um, I mean, she's seen a lot of kids that were just like, there's no way these kids are waiting until summer. They need that tooth out. They need it out now. I mean,
Hmm.
it's crazy infection going on, right? So those are the kind of things we're doing. In terms of numbers, again, we're only seeing one person at a time, so maybe 5, 6, 7 people. My day this week was Wednesday, and I saw about 7 people.
Hmm.
Um, 2 were referred to the oral surgeon. A few we patched up. I mean, we're trying to minimize flow to keep people away. But yeah, so you know, limited exam and a PA times 7. That's
Hmm.
our production right now. you know,
Yeah. So, one thing that I did want to ask you about, because you had mentioned earlier about trying to minimize the use of the handpiece when it comes to treatments that you're going to be doing, but you're someone who's actually been using the Solea laser from Convergent Dental, which allows you to eliminate the handpiece from some normal routine procedures even before this COVID pandemic hit. How does that laser and the technology that it brings into your practice factor in, and does it change any of the types of things you might be able to do right now?
that is actually an ongoing. That's a good question. Ongoing discussion now. I mean, you consider the modality of a burr, right? So we have Cavo high speed electrics. Those are spinning at 200,000 RPMs. And it's just basically taking stuff and just shooting it up into the air, right? The way Solea works is it fires a 9.3 micron beam to the surface of a tooth. Um, is highly absorbed by hydroxyapatite, and then that hydroxyapatite is basically vaporized. It does that by superheating that 2 micron depth to about 1200 degrees Celsius, right? So it's kind of, I mean, anything it points at, it's kind of killing. It's not really whipping stuff around. It's a beam of light that's vaporizing stuff. And most viruses aren't viable past 60 to 80 degrees Celsius anyway, right? And then we're
Hmm.
superheating this top layer to 1200. Um, so no, there hasn't been any studies done. I know Convergent Dental is working on that. And in some ways this is conjecture because we don't have any study that's done like where we're looking for those particles to be thrown off or not, or aerosolized. um, but from a theoretical standpoint, I think we're probably looking at something that quite possibly could be safer to prep teeth with. So, and then the other part of that too is how much water is coming out. Typical handpiece, 30 to 60 milliliters per minute. If you're bombing through on a crown prep with a big old fat diamond burr, you have a lot of water coming in. And Solea only uses 10 to 11 mils per minute. So there's just less water in there anyway. So without being, I couldn't tell you scientifically that's the case, but just looking at kind of the science and the physics of how this thing works anyway, my thought would be if you had to pick a tool, I would want the thing that's most likely killing virus while it goes, not just shoots it into the air kind of thing.
Hmm. In terms of getting that type of messaging, when you do have science, if the science comes back and confirms what you're believing might be the case right there, I imagine that's the type of thing you'll want to get out and talk to your patients. But right now, are you in any communication with your patients, at all during this last couple of weeks? And if so, what are you doing to try and kind of stay in contact and to be, just letting them know you're there for them and you'll be there for them in the future?
Well, that's just it, actually. I mean, we have a list of email addresses, of course, um, and most people, have email addresses at least as a family now. So we're actually sending messages of, here's what's going on. We're here for you. Here's what it'll, if you do need to come in, here's what that'll look like. And pretty much primarily we're using email right now to do that. Um, but then we also have someone on the phone 8 to 5 every day. And even if they hadn't seen the email, they're calling and they're like, I'm dying right now. My tooth is killing me. I haven't slept for 3 days. Are you guys open? So I think one main thing is, even if it's, for a dentist, I mean, if you're not paying a staff member to do that, at least figure out how to forward the phones to your cell phone, because I guarantee people are trying to get a hold of you. And you know, and the interesting part is we've had people call and we're not even sure what the problem is initially because I think this whole idea of shelter in place, and um, people are scared and confused, and I think looking to us to be kind of a place to get some grounded advice on some things. So definitely, as much as you can, keep your phones going. Not necessarily voicemail. Um, I know it's hard, especially if you're trying to pay people to do that, but
Mhm.
that's kind of one of the things we're trying to just keep the communication open.
Yeah. Speaking of communication, how have you felt about the communication from state, local, federal authorities, industry associations? Are you getting the information you need from, reliable sources in this instance, during this pandemic?
Oh, it probably more, probably overwhelmingly amount. Um, I mean, the California Dental Association has been great. Before the state even talked about, essential workers and who could work and who could, I mean, CDA and the ADA were already all over this. So that was really helpful in terms of knowing where we needed to go, what kind of guidance they could give us. Because at first we're sitting there going like, well, do we close or not? I mean, and should we close or not? So that has been great. But no, if anything, I mean, our awesome rep from Nobel has been forwarding all this great CE and different things. Our Patterson rep, there's a webinar later today on is OSHA changing and what those new requirements might be. I mean, we're getting an overwhelming amount of good information. We even got an email from Colzer. It's like, hey, here's 10 things you should be doing if you have to see people. And it wasn't by our product. It was, here's some helpful information. Um, so it's been great. But if anything, the amount of emails we're getting is like over the top, you know, with
Hmm.
with information and online opportunities and all these things. So
Yep.
it's good.
In terms of, you mentioned some webinars and some other things. Obviously, there's probably some more free time in your day than you're used to having. What have you been filling that time with? Is it, works related stuff, or you just spend an extra time with your family when you're not at your practice? Kind of what are you able to do with that time that you wouldn't normally have been doing?
Yeah. So actually, a lot of it, like this week, has been filling out all that for the loans,
Hmm.
uh, getting the PPP stuff going, getting some accounting done, figuring out employee issues. I feel like I've talked to my accountant more in the last month than I think I ever have. And they've been super helpful for us. Talk about another source. Um, but no, the weirdly enough, life wise, one of our constant complaints was always like, oh my gosh, we're so busy. We have all to do. We're constantly scheduled, volleyball practices and things, which we love that. Those were and are all good things. Soccer games and recitals and but if anything, now we've had more time to just be home and be with each other. And, we got our garden going and just bought some chickens, like just random projects around the house are finally getting done, and we're eating dinner together every night. I mean, this has been um, anything of kind of a blessing is to, hey, if we got to shelter in place with each other, um, you know, this is not a bad way to go. Um, you know, board games and movie nights and all that kind of stuff. It's been fun. So
Hmm. Well, sounds like you're taking the best advantage you can of that extra time at home, which, I think we all need to try to look for those bright sides right now.
right.
Uh, yeah, I guess that really kind of wraps up the topics I'd hope to, broach with you. I don't know if there's anything else you kind of feel is important for dentists or other healthcare professionals to kind of know about what's happening, your personal experience through this or your thoughts on the industry.
Yeah. So that's I don't think I have anything new compared to what everyone else might be saying out there. I mean, we're just in a unique time. And more than ever, I think our patients and staff are kind of looking to us to kind of be a leader in this space. And if anything, just to encourage you, you know, even though the profession's sort of evaporated overnight, I mean, no, you and I were talking earlier this morning about, we said, okay, let's say on average there's 150,000 dentists, 250,000 hygienists, let's say, so that's, we're up to 400,000 people. Let's say every dentist has only one assistant and one office manager. That's 700,000 people on a conservative estimate affected by this.
Hmm.
Um, so it's kind of crazy time, right? But I would just encourage everybody to to know that our profession is not going away. The need for this niche part of healthcare is not going away. It's going to be different for a little bit. It's certainly different right now, but I think a few years from now we'll look back and go like, this is crazy, but we're going to continue on and continue to take good care of people, and um, it's going to come back, whether that's June or May or August or hopefully not January next year. But it's there is an end in sight, and I think if anything, we're going to find we're so busy catching up that it's going to kind of make up for lost time in a way. So stay positive as much as you can, and protect yourself, and it's know that there's going to be an end to this at some point.
Well, Dr. Rohde, we really appreciate your time today. Thanks for joining and sharing your thoughts and experiences with us. And stay safe and take care of yourself.
You too, man.